I'm Dr. Lisa Palmer, Dr. Mama Bear, and
Leah.
And who?
Leah.
And Leah, and we're joining you live from Florida on the topic of women's health,
weight loss,
and wonderful results. Leah wanted to be my special guest today, and so here we are. When it comes to women's health, it's probably one of the most common things that we work on, and it's unfortunate that there's so much data out there that's so confusing for women. Should you be taking oral contraceptives? Should you be taking hormones? Should you be taking bioidentical hormones? Should you be taking estrogen, progesterone, testosterone? It's really, really confusing out there. And so what ends up happening is that someone gives a female advice, and then they end up kind of on like this roller coaster disaster zone. Most commonly, what I see is female goes in to her primary care physician. Primary physician says, "Well, you're going through the change, and you don't want to have dryness or no libido or lose your body composition, get fluffy. So here's some testosterone, or here's some bioidentical hormones." The problem with is when you start to take hormones is that it negatively affects the rest of your endocrine system. So your endocrine system is a part in your brain called the hypothalamus, a gland in your brain called the pituitary gland, the gland in your throat called what's this one called?
I forget.
The thyroid gland. The thymus gland. The pancreas is an endocrine organ. If you're female, your ovaries. If you're male, your testicles. And then the glands responsible for stress hormone are adrenal glands. And so when you take hormones, it imbalances the rest of the endocrine system. And so lately, what I've been seeing for women's health and weight loss is people getting prescribed semaglutide. Also the brand name Ozempic. And so Ozempic is a diabetes medication. Ozempic is meant for people with high blood sugar. And for whatever reason, lately it seems like a lot of people are prescribed by their medical doctors Ozempic for weight loss. Now, any time you take a medication, it always has a side effect, right? There's always a side effect. Whenever you take a chemical, there's always an effect to that. There's always a negative effect. It's like, I don't even know. Robbing Peter to pay Paul is another saying, right? Like
what?
Robbing Peter to pay Paul. Like it's not a good solution. Oh no, we lost camera. Oh man.
Wait, did the video go out?
Our video went out. I don't know why our video went out. So our sound is still there, but some reason our video just went out, which is poopy. Let's try again. I don't know why our camera went down. Oh no. That's not good. Okay, well, I guess we could do this podcast style. It'd be really nice to have our video back up. No.
What podcast style?
Podcast style means that they just hear you and they don't see you. Okay, well, we'll make this short then because we lost camera. So the whole point is a lot of people are getting prescribed Ozempic. Ozempic is a medication for diabetics. And unfortunately, a lot of women are being sold it for weight loss. When you take a medication, it always has side effects. And some of the side effects of Ozempic are pretty nasty side effects. The most common side effects of Ozempic are, well, let's read the list. It's pretty long. Anxiety, bloating, blurred vision, chills, cold sweats, confusion, constipation, cold pale skin, cough, darkened urine, depression, diarrhea, difficulty swallowing, dizziness, fast heartbeat,
fever.
Fever. Oh, you're going to read them?
Headache.
Increased hunger.
Indigestion, large hive-like swelling on the face, eyelids, lips, tongue, throat, hands, legs, feet, or sex organs, loss of appetite, nausea, nervousness, nightmare, pain in stomach, side or
abdomen,
possibly rotating,
radiating to the back,
seizures, skin rash, slurred speech, tightness in the chest, trouble breathing, unusual tiredness or weakness, vomiting, yellow eyes or skin.
So those are the more common side effects of Ozempic.
Yellow eyes.
Yellow eyes. Do you know why the eyes turn yellow? They turn yellow because that means the liver is failing. They're getting jaundice. So those are all.
I don't want my eyes to be creepy yellow.
Wait, are you taking Ozempic?
No.
No, yeah. So the whole point is that every medication has a side effect. If you want to lose weight, what we do with quantum nutrition testing is we look for the cause. We look for, why is your body holding on to weight? Why is your body holding on to fat tissue? Toxins like chemicals, chlorine, formaldehyde, fluoride get stored in fat tissue, and they will not be released unless you do something to detox them. Now, you can go to your local CVS, Walgreens, Whole Foods, whatever, and do a random detox. It does not mean you're going to lose weight with that. You can severely restrict your calories. You will lose weight, but the moment that you start eating a normal amount of food again, you will gain that weight back. So instead, we look for, why did the body gain weight? What is the cause? We handle the cause with whole food supplementation, herbs, electrolytes, minerals, rebalance the body, look for the source of the problem, and we handle it. And so if you need our help, we'd love to help you. I'm Dr. Lisa Palmer, Dr. Mama Bear, and have a great night, everybody. Good night.
Bye.